for a sort of bonus update, the second update we're doing this week. Uh, I'm happy to announce our next policy plan, which is the WAGOP's plan to tackle homelessness. This is really something we're excited about. It's one of the policy statements that people have been asking us the most to come up with. And, uh, and I think it's a place where we can really advocate for doing more to really reduce homelessness in our state. Stop just the talk, stop just the, grant operations and the think tanks and the research and the focus groups, and actually move the state toward taking practical steps that will get people off the street and into transitional housing, into permanent housing, on a better path in their lives. Everyone's frustrated with the ineffective job that the Washington state government has done in trying to resolve the homelessness issue. We've spent literally billions of dollars trying to get people off the streets in our state. But just in the last few years, from 2020 to 22, the number of homeless people has increased by about 15% in our state. I mean, that's terrible. We're spending more money and the problem's getting worse. So what we've done at the State Republican Party is we've taken a lot of the best thinking, best writing on how to really do something about homelessness and distilled it down to a plan that's based on 6 principles with regard to law and public policy related to reducing homelessness. And I'll read you quickly the 6 principles because they're good. First of all, and most importantly, stop the flow of illegal drugs into our streets and our neighborhoods. Homelessness is a bunch of different issues combined, but the biggest single piece of it is drug addiction. The second principle, strengthen comprehensive mental health care, rehab, and job placement. In our state, we've destroyed, through mismanagement and incompetence, our system for delivering mental health care to people who are mentally ill. The flashpoint in all of that failure is the condition of Western State Hospital in Pierce County and the west side of the state. That facility, which has been one of our state's main assets in getting mental health care to those who need it, has been mismanaged, as you probably know, decertified by the federal government so that it can't receive most federal government program monies, and just mismanaged to the point that it's mostly empty. And those people who should be in there receiving care are out on the streets. The third principle is end pay-per-needle grant programs. The term grant grifter gets used a lot by cynics and critics of what we've been doing in the healthcare for homelessness area. And a lot of this healthcare for homeless people, it's managing drug addiction. It's getting them off the drugs that they're using. You hear the term harm reduction used in these circles sometimes. All of this is basically a business model for certain nonprofit organizations to provide the hardware of addiction to the addicts. Now, this may be well intended, but it only perpetuates the misery and suffering of those addicts. We need to move away from using taxpayer dollars for those kinds of programs. The fourth principle, defend businesses and public spaces. It is a failure of government when people in the throes of addiction, when criminals trying to control the streets take control and dominate our public spaces, public parks, sidewalks, in some cases, schools. We cannot allow this. We have to keep our public spaces clean and open to all people. The fifth principle is admit the failure of housing first policies. For a couple of decades, our state government has been heavily invested in promoting the so-called housing first approach to getting people off the street. That means giving taxpayer funded housing to people who are actively using illegal drugs and actively addicted. We need to combine housing to people in need with the demand that in exchange for that housing, they at least make the effort to get clean and sober. Housing first enables addiction, enables drug dealing, and enables criminal behavior. We can't support it as we have. And the sixth and final principle, to really do something practically to reduce homelessness in our state, focus on keeping our neighborhoods safe. That means enforcing the law. There's a lot to homelessness. It's a complex issue. But if we stick to these 6 core principles, it will lead us in a better direction about actually doing something to get people off the streets in Washington State. We're committed to this, and we think that it's a plan that will help everyone, and that everyone in the state can get behind and support. I'll be talking more about it in the weeks to come. As I've said, there's a lot of material to cover when we talk about homelessness, and we'll be drilling into detail on some of those matters as we go forward. But for now, these 6 principles, they're the core of what we believe will bring better policy and better results to our efforts to reduce homelessness. Have a great week. I'll talk to you soon.
Cool.
That was good.